welcome back to another edition of Beacon Spotlight Podcast. I'm back again with Dr. Jaydeep Chunduri, and we're here to talk about minimally invasive spine surgery. Dr. Chunduri, what is minimally invasive spine surgery?
The definition of minimally invasive spine surgery can be quite varied. Some people may say it's doing a surgery through a very, very small incision, while others may say it's a procedure that's done with what's called a muscle-sparing approach. Either way, the idea of minimally invasive surgery is to allow lesser harm to the tissues, less muscle stripping, less blood loss, and theoretically a faster recovery time. There are multiple ways of performing minimally invasive spine surgery. The traditional way and the initial ways that this was done was through a posterior approach, meaning through the back. And typically what would be done is you would put your, if someone needed a spinal fusion, you would basically perform that through incisions on each side. What you would do is put your screws in, and you can do those through very, very small incisions using x-rays and neurological monitoring, and put your screws in. And then afterwards you would do your what we call decompression, or opening up the space around the nerve through a small tube. And once you do that, you can actually get right down onto the disc space and take out the disc, and then in place of the disc we put something called a cage. What a cage is a piece of plastic or metal that helps hold the disc space open, and it's filled with bone graft or bone graft substitutes that helps to allow for a spinal fusion. And you can do that all through very small incisions, minimal muscle stripping, and again, some people are able to go out of the hospital the next day after surgery, or some even the same day. But what we found is that patients tend to do a little bit better with this procedure where it's indicated. The more recent advances in minimally invasive surgery have been anything that can avoid working directly around the nerves. One of the things that we use in our elderly population is a procedure called the X-dot procedure, and this is basically where you place a device between the spinous processes. The spinous processes are those bones that you feel right down the middle of your back. And by doing that, we can open up the space around the nerve and not have to do any other work in terms of a fusion or the traditional laminectomy, which is opening up all the spaces around the nerves. The problem with doing that is it's a much bigger procedure, more recovery time needed, and there's the potential for scar tissue formation. The nice thing about a procedure such as the X-stop is that you do not need to, if you need to go back and revise it, it's fairly simple to go back and do it. You haven't burned any bridges. The most recent advance in minimally invasive surgery is lateral surgery. And lateral surgery is something that uses a very different approach to the spine. Traditionally, we have the front approach where you can go in through the abdomen and approach the disc that way, or you can approach it from the back. But the lateral surgery allows us to go in through the side, through the psoas muscle, which is your hip flexor muscle.
So what are the advantages of having lateral surgery?
Well, lateral surgery works very, very well when you need to reconstruct the disc space, or in a patient that has scoliosis, or curvature of the spine, where you want to try to adjust the angle of the disc in order to try to straighten out the spine. The other place that it's works really well is in someone that's had multiple surgeries before, and the procedure allows you to have access to the disc space. Basically what we're doing is we're placing the patient on their side and making a small incision essentially right over the disc space, and you're going through the external abdominal muscles and coming right down on top of the disc space. You're able to sweep everything forward, and through these small retractors you're able to expose the disc space and directly look at it, and then take out the disc and reconstruct the disc space with your cage. Again, the cage is a device that's designed to help hold the disc space open until your body's able to fuse. And then indirectly you're able to open up the space around the nerves and take care of that degenerated collapsed disc, all without directly working around the nerves. Now, lateral surgery works very well when you're using neurological monitoring to make sure that you're nowhere near the nerves, and when you're able to use a bone graft substitute along with the cage. So it's a relatively new procedure that's been around for approximately 5 to 6 years and is coming into wider acceptance.
Thanks again for all the great information, and stay tuned for another edition of the Beacon Spotlight podcast.